The facts are indisputable. Black is beautiful. A brand new day. Back to business as usual. See, we built empires and engineers and scientists. Gave a glimpse into the past through Egyptian hieroglyphs. Black is beautiful.
This is The Real Deal with Emiel, brought to you by MHD, your local year-round trusted insurance partner. Let MHD help you for free. Good afternoon, Kansas City. You are listening to The Real Deal with Emiel, and I am your host, Emiel Cleaver. This show is produced by Phillips West Public Relations and Communications. And as always, I want you all to call in and join the conversation. If you have any questions or comments, you can call 816-576-7400. I want to take a time out just for a minute to let everyone who's listening know about the Black Archives of Mid-America. It's located behind the American and Negro Leagues museums. The Black Archives of Mid-America was founded in 1974 by Horace Peterson, and it has the largest collection of Black history in Kansas City. Not only Kansas City, Missouri, Kansas City, Kansas, and some of the surrounding states. And I think it's important that we discover our history. We have a lot of history down there, beginning with the Lewis and Clark expedition, going through slavery, up until today. And there's a lot of information down there. And I know a lot of people in the city don't even know about the Black Archives. So I just wanted to take a minute out to let you all know. It is located at 1722 East 17th Terrace in the 18th and Vine Jazz District. Like I said before, located behind the American Jazz and Negro League Baseball Museums. And if you want to check out the archives, see what we have going on, you can go to blackarchives.org. We have a few events going on this month and next month. So you can go to blackarchives.org. I also want to thank my sponsor, MHD. MHD, your trusted insurance partner, has an open enrollment center located on the corner of 18th and Vine. Now, speaking of MHD, my guest today is Charles Hazley III from MHD. Welcome to the show.
Thank you for having me.
Now, I know you've been on the show before, and I've talked about MHD before, but for those who are listening for the first time, can you let everyone know who MHD is?
Sure. MHD is a minority-owned insurance brokerage firm started by John McDaniel and my late father, Charles Hazley Jr. We are committed to excellence in the community, and we want to be your trusted individual, family, and business owner insurance partner. And our enrollment center is open all year round. So if you have any questions about insurance, whether it's the Affordable Care Act, Medicare, or any other coverage issues, we're always open and we're always eager to help.
Great. Now, I want to talk a little bit about Medicare. For those who don't know, I mean, we hear a lot about Medicare in the news, but can you explain what is Medicare?
Sure. Medicare is the federal health insurance program for seniors or people 65 or older. It's also for certain people with disabilities, and it's for people with end-stage renal disease, which is also known as kidney failure.
Okay, so are there different parts of Medicare, or?
Yes. The main part of Medicare is Medicare Part A, which is your hospital insurance. It covers all your inpatient hospital stays, your care in a skilled nursing facility, hospice care, and some other health care options.
Okay, so how can someone sign up for Medicare?
Actually, open enrollment is starting on October 15th through December 7th. And you can either, we would suggest that you talk with someone, because we're finding out is a lot of our seniors just sign up for Medicare. They don't really understand all the parts of it, and it can be pretty challenging to go in it by yourself. So what we want to do is make sure that all of our seniors, your mothers, your grandparents, have the right coverage for their budget. Make sure that they're in the right situation, because we know that a lot of our seniors are also on fixed incomes, and they don't need to be wasting their money or their time in a program or a coverage that is not right for them.
So you all will look at their the individual situation and determine what's best for that person.
Yes, sir. We do free consultations, and we look at all your coverage, and we look at what your budget may be, what your prescriptions may be, what your underlying health conditions may be, and we make sure that you're signed up for the right coverage.
Okay, so when someone signs up, when will the coverage start?
If you sign up during the initial enrollment period, it should start on January 1st.
Okay, and once again, the enrollment period is from?
It is from October 15th through December 7th, but there are also sometimes during the year where you can sign up for a special enrollment period.
Okay, I was just going to ask you that. If someone misses the open enrollment deadline, what can they do? And are there penalties?
Yes, there are actually penalties if you don't sign up on the day. It just depends on when your birthday is. Generally, you can sign up if you turn 65. You have a 3-month window before you turn 65, the month that you turn 65, and then 3 months after you turn 65 to avoid any penalties.
Okay. Now, and what are the Medicare Advantage plans?
Medicare Advantage plans are basically a type of health plan offered by private companies that contract with Medicare to provide our seniors with your Part A, your Part B benefits, and some offer Part D drug coverage. The important part to know about the Advantage plans is that they eliminate the 20% that you have to pay on original Medicare. So if you are on a fixed budget, you may want to look at a Medicare Advantage plan, which MHD can help you do as well.
And who can join those? Who can join those Medicare Advantage plans?
If you're eligible for Parts A and Part B, you can join a Advantage plan.
And so if there's a number, is there a number or website somebody can call to get all this information?
Yes, you can go to the Medicare website, or better yet, you can call down to MHG at 816-399-4040 and talk to a licensed Medicare agent.
Okay, and once again, if you are just tuning in, I am talking with Charles Hazley III from MHG, and we are talking about Medicare. If you have any questions, comments, concerns, give us a call, 816-576-7400. Now, what are Medigap plans?
Medigap plans are plans that are added to your original Medicare, and they're there to help pay some of the health costs that original Medicare doesn't cover, like co-payments, co-insurance, and deductibles. Some Medigap policies also offer coverage for services that original Medicare doesn't cover, like medical care when you travel outside of the U.S., or if you have original Medicare, you can buy a Medigap policy. Medicare will pay its share of the Medicare approved amount for covered health care costs. Then your Medigap policy pays the remaining balance.
Okay, and who can join the Medigap? I mean, is that open for anyone, or?
You must have Medicare Parts A and Parts B to join the Medigap plan.
Okay. Now, what is a donut hole?
Donut hole is basically has to do more with your deductible and your prescription drugs. This means that there's a temporary limit on what the drug plan will cover for your drugs if you're in a Part D. Not everyone will enter the donut hole, and the coverage gap begins after you and your drug plan, which means your insurance company, have spent a certain amount for covered drugs. In 2016, the amount will be $3,310. Once you hit that amount, you will be in what's called the donut hole. This amount could change. It'll probably change every year going forward. But basically, if you hit that donut hole, which a lot of people do not unless they are taking a lot of prescriptions, once you hit that donut hole, you will pay 45% of the plan's cost for covered brand name prescription drugs, and I believe it's 58% for preferred drugs. Or actually, let me see. It's 45% for covered brand name prescription drugs and 58% for generic drugs. I'm sorry.
Okay. Now, what are some of the other services that MHG offers to seniors in the market that might help them choose the best option?
Sure. We know benefits and costs change every year. We at MHG feel that eligible Medicare beneficiaries should always review their plan each year to make sure that their plan will still meet their needs. You know, there is no cost for our services and our consultations, and all your seniors can contact us at, again, 816-399-4040, or walk into our enrollment center located at 1520 East 18th Street. And we believe working with an MHG licensed agent, you can be confident that we will help you make informed decisions regarding your Medicare options.
Okay, now what if someone is on public housing, gets public housing assistance, food stamps, or other assistance? Can they still qualify for Medicare?
Yes.
Okay. Mm-hmm. Now I want to switch subjects a little bit. Now, the Obamacare, affordable health care. Now, when is the enrollment for that?
That is starting in November, November 1st, I believe.
Okay. And now if someone is needing health care or just basic health care, what would they need to do?
First of all, they would need to make sure that they qualify. There's always there's an income qualification that you have to meet, and it is based on your monthly or yearly income, and it's also based on your house size and who all you claim on your taxes. So when I say that, I want to make sure that people understand this is not for people who do not have jobs. You have to have income to qualify, whether that income is from Social Security, from your job, self-employment, but it's all based on your income and your family's income and your family size. We had a lot of people that were confused in thinking that Obamacare was for people who were below the poverty line, or who did not have employment, or Missouri did not expand Medicaid. So unfortunately, there are holes in the system that we can't help everybody. So if you are employed and you want to look at coverage for yourself and for your family, we would suggest that you come on down and let us run the numbers for you and see if you qualify.
Okay, so what if someone, you said it's based on income. What if someone, makes quite a bit of money, but their job doesn't insure them? I mean, if you make too much money, will you still qualify?
Yes. You may not receive a government subsidy, but the Affordable Care Act income guidelines goes up to 400% of the poverty line. So we've been able to insure working class families, and even some families that make a little bit more than the average family.
Okay. Now, you mentioned subsidies. Could you explain to the audience what those are? I mean, a lot of people don't understand the language in insurance.
Well, the Affordable Care Act is all based on your income, as I said before, but the main part about it is that once you qualify, you will receive a government subsidy, and that subsidy is sort of a discount on what your insurance will be. So basically, the Affordable Care Act will pay a certain percentage of your health care, of you and your family's health care, and it's all based, again, on your income. So we've seen some subsidies as low as $30 a month and some as high as $900 a month. It just depends on the size of your family. We all know that a little bit helps here and there. $30 helps, but $900 really helps. So Again, let us run the numbers for you, and those government subsidies are out there. So if you're on the fence or you're confused, come on down to MHG. Let us work it out for you.
Okay, now do you have any idea of the number of people who aren't insured? You may not. I mean, I know there has to be quite a few, especially African Americans, who aren't insured.
Yeah, I don't know the exact numbers, but I do know that the ones that do not carry this minimal essential coverage will face a tax penalty. Those tax penalties, I believe this year were going to be 2% of your income. So if you don't want to pay that tax penalty, and you also need to have some health insurance, come on down and let us talk about it.
Yeah, I know African Americans have a funny relationship with insurance. You know, back in the day, they used to come to your house and collect money, and a lot of times those insurance companies wouldn't pay out in the end. So I know black people have a funny relationship with insurance companies, but anyone out there listening needs insurance, especially some of the particular needs of African Americans. What are some of the other I guess services that MHG provides?
Again, we are a community-based organization, so we feel that any information that we can give to our community on insurance or on life insurance policies, we just want to provide our community with knowledge. Insurance to us is a basic, essential need. A lot of times we lose our loved ones unexpectedly, and we don't have the money to handle their final expenses.
Right.
That's a big thing in our community. Doing fish fries and raising money and GoFundMe, that sort of stuff. Well, that's what life insurance is for. And life insurance is relatively cheap when you get it young. I know people don't like to burn bread. I don't want life insurance because then I'm opening up the door for death. But death is right around the corner for all of us. We just want to make sure that we protect our livelihood, our families, and our legacies, which could be our homes or our businesses. So we do a lot of life insurance consultations as well.
Okay, and life insurance is really, really important because you don't want to pass on and leave debt to your family members. So
you don't want to lose your home. You don't want to lose the business that you have worked so hard to maintain, and you want to also be able to leave something to your spouse and your children.
Right. And I know you all have talked about some events. Are there any events that MHG is having, any seminars or anything like that coming up?
Yes, we are out in the community. We have several Medicare seminars scheduled. We have a couple at the Buford Library. We have some at the 63rd Street Library. We have one coming up this Saturday at the Kansas City, Kansas Downtown Public Library. And we're just explaining Medicare and the do's and don'ts and just trying to clear up some of the confusion. And we're also helping Blue Cross Blue Shield launch their new Blue Advantage Medicare Advantage policy. So we're getting real geared up for the enrollment season, the Affordable Care Act as well. So look for our flyers out in the community, and there will be a limited advertisement. But if you are your relatives, moms, grandparents, have any questions about Medicare, please send them our way.
And we'll be talking about it here on the show, making sure everybody knows. You mentioned Blue Cross had a special promotion. Is there, what's different about that, or what's the advantage?
Blue Cross has not been in the Medicare business for several number of years, and they have seen a need. They've seen a need for a brand new product. This Advantage plan is going to come in and save a lot of people money, and we all know that Blue Cross Blue Shield is a trusted hometown partner. They have been in business for many years, and here in Kansas City they're one of our community staples. So we're real excited about Blue Cross Blue Shield coming back into the Medicare field, and we think that their product is a very good product, and we're looking forward to launching it out into the community.
That sounds great. And like I said, we'll be talking about that on the show, letting everybody know about the seminars and dates. What are some of the I guess most asked questions when you do these sorts of things?
Basically, what is Part A, what is Part B, and what are the advantages of having an Advantage plan? And I think that's going to be a very big part of these Advantage plans. I believe that they will save some of our seniors some money, and especially attaching that prescription drug part into it. That's just another part that our seniors won't have to pay. The Advantage plan encompasses Part A, Part B, and most have a Part D prescription drug aspect to it.
And that's important because a lot of people spend a lot of money on prescription drugs.
Yes, sir.
Which is a big part. So, is there anything else that MHD that you want the audience to know about MHD or insurance? I know there's probably a lot of questions. We can't answer them all here on the air. But I mean, I know there are a lot of people who don't understand the basic language in insurance. Like, for example, paying off a premium, or can you explain to the audience what that is? Or a deductible.
Sure. The premium is basically your responsibility to pay your part of your insurance payment. That is what you are responsible for as the beneficiary. Co-payments are parts of the payment that the insurance company or even the Affordable Care Act pick up to help you pay for different things outside of the premium. What was the other one you asked me about?
It was the premiums and the
deductible.
Deductible, right?
Yes,
right.
The deductible is the amount of money that you have to pay in premiums and even in your prescription drugs. Once you hit that point, say your deductible is $5,000. Once you've paid into that out of your own pocket, then most services after that become the responsibility of the insurance company. So you always want to keep an eye on your deductible, and once you hit that deductible, then again, most services are covered after that.
So is it best to get a plan with a high deductible, low deductible? I mean, or does it matter?
It matters a little bit. High deductible, low premium, high deductible. So you have to look at your situation and your financial situation and figure out where do you want to pay the most at. Is it in the back end or is it in the front end?
Mm-hmm. And once again, can you let everybody know when Medicare enrollment starts?
Yes, sir. Medicare enrollment will start October 15th in roughly around 2 weeks, and it will end December 7th.
And they can all enroll down on 18th and Vine at the Enrollment Center. And also, when is the affordable health care, the Obamacare, when does that?
That is November 1st through January 31st.
And if you don't sign up for these, you will be penalized. Yeah. And once again, you have to have a job, right? You have to have a job.
You have to have some sort of income.
For both the Medicare and the...
Well, the Medicare is paid through your Social Security. So you've had to have paid into the Social Security system until you retired to qualify.
Okay. So you have to be a retired person to qualify for Medicare.
Yes.
And for Obamacare, you have to have a job. So I know there's a lot of people out there who need health care but don't have a job. Now, what if you have a part-time job?
It just depends on your income. To qualify for a single person, you have to be making at least around $1,000 a month.
Okay.
Mm-hmm. And I think that equals out to about $12,700 a year. So the standards are kind of low. I assume some would benefit if they were a little bit lower, but right now, around $1,000 a month could get you qualified for the Affordable Care Act.
Okay. And about how much would they pay? Do you know, have an idea about how much, someone with that low income.
From my experience, someone making around $1,000 a month would pay 0 to probably less than $50 a month, depending on the level of coverage that they're looking for.
So it's possible for someone to pay 0.
Yes, we have a lot of our clients, because of their financial situation, their premiums are $0 a month.
Okay, so if you're out there listening, I mean, you may qualify to get insurance basically for free. So if you're going without insurance, you need to call MHG and let them figure out what plan is best for you, what plan works for you. Also, once again, you all have a seminar at, you said, the library coming up. I want to make sure everybody knows about that.
Yep, our first seminar, again, is going to be at the KCK Public Library, and it is this Saturday, the 3rd, and it is 10 to 12. The dates for our other ones are, we haven't announced those yet, but we will be doing that very soon. There will be later in the month in October.
Okay, and is there any information or a sign-up sheet that they need? Do they have to RSVP for this event?
Nope, just come on down. Bring your questions and bring your moms, your fathers, and your grandparents. Let them get informed. Help them get informed and make sure that they are in the right situation for them.
Okay, now you heard it. We have to make sure we have our community insured. There are a lot of people that aren't getting insured. So MHG has all that information. Located on 18th and Vine. Make sure you come out to the library this Saturday. I want to thank my guest, Charles Hazley III from MHG.
Thank you for having me.
And I want to thank MHG for their sponsorship. And again, next week, same time, same station.
Nothing like the ruling time to build our team, so we can tell Dr. King we fulfilled your dreams. The origins of man can be traced back to Africa. The facts are indisputable. I'm black and spectacular. The facts are indisputable. Indisputable. Black. Beautiful. It's beautiful.
The Real Deal with Emiel, brought to you by MHG, your local year-round trusted insurance partner. Let MHG help you for free.